I fell sick while about 1.5 years into working. So I had the typical symptoms of fever, cough, and night sweats. So I tested myself without actually going through a proper physician. So I sent a sample for Nielsen testing only initially, but it came back negative. But it went into culture. But I wasn't aware of it initially. So after 6 months only, the culture came back with the sensitivity results, and which shows multi-drug resistance. So there was a delay of 6 months, I would say, for the treatment initiation. During the initial months of treatment, I had very bad nausea and vomiting. I lost more weight than while I was while I had TB. And I am on injectables, intramuscular injectables daily for 8 months. So it was very painful. But after 3 or 4 months, I was rotating different sites for injections. But all the sites starts to get hardened. So when you inject, it's actually get more painful when the sites were hardened. And also, one thing that I had throughout was insomnia due to the drug-induced insomnia. I had to take time off of work due to the disease, as it's an infectious disease. And it was actually quite devastating for me because I was doing my internship. Then it's only 2 months left in completing it. Initially, they weren't really sure what to do with it. They were like saying that maybe I had to repeat the whole thing, which I already went through 1 year and 10 months of the internship. But luckily, in the end, they did not decided to do that. And of course, also, although I'm a medical personnel, I also experience social stigma due to the disease. Like, people will fear that even though after 8 months I went back to work, some of the people will still feel a bit, like, why are you sure you don't need to wear a mask, things like that. I think it will mean a lot if we can shorten the duration of treatment. And of course, treatments with lesser side effects will be a bonus, because I think a lot of patients might have dropped out from treatment due to the side effects, because the drugs really make you feel sicker. For me, it really make me feel sicker than the disease itself. So as for diagnostic part, I think it will be a bonus if we manage to detect earlier and start treatment earlier.